So I was attending a talk by TM Forum's chairman, Stefan Rowan, earlier today, and he said whenever you do a project, set your goals really high, right? And then understand what problem you're solving. It's not just technology for the sake of technology, you need to be solving a problem. So we set our goal to be saving 1 billion lives, and the problem obviously is healthcare. So what can we do about it? So when we started off, there's a few interesting statistics that I'd like to share with you. This is from the World Bank. So very good. Pat on the back to all of us here, right? 103% penetration for mobile cellular subscriptions. Excellent. We've done well. That's more than one a person. And it's growing. It's actually growing at a phenomenal rate. I found one more statistic on the World Bank website, and that's half the world lacks access to essential healthcare services. And I thought something's wrong here. Something's upside down. I mean, if I look at life and what I expect from life, there are a few must-haves, there are a few nice-to-haves. Must-haves for me is food, water, sanitation, a roof over my head, healthcare. Nice-to-have for me is mobile connection, social media, entertainment. But if you look at the world today, everybody's got mobile connection, entertainment, social media, and half of them don't have healthcare. So I started thinking, how did it get this way, right? How did we get to where we are? So a little brief look back through history, a little bit of healthcare then and now. And if we go back in healthcare a long time ago, then what was our biggest healthcare problems were acute diseases, right? So things like cholera, typhoid, malaria, right? People were dying from these things, the plague, right? Nobody was worried about heart attacks. Nobody was worried about cancer at that point in time, cardiac issues. These were not a problem at all. And if we look at the progression of healthcare, particularly in the West, we've gone from acute illness to lifestyle-based diseases, so things like cardiac disease, cancer, etc. And now we are more interested in fitness or wellness even. I mean, can I count how many steps I take every day, right? How can I be even better in my health? But that's not the case everywhere in the world. In developing countries, they are actually facing a twin epidemic, right? They have the same lifestyle-based diseases, things like diabetes, cancer, heart disease, and they also have acute healthcare issues. So there still is typhoid, there still is malaria, and you wouldn't believe it, but in many parts of the world, people still die from diarrhea, right? I mean, it's something as simple as that can still cause death. And the key reason for all of this is a lack of access to diagnostics, right? I think that's two parts to it. One part, the diagnostics, people don't know what's wrong with them early enough, right? And these statistics were really shocking to me, that 1/3 of people who have cancer die prematurely because of late diagnostics, right? People who have diabetes, they go undiagnosed for ages until eventually you need to have an amputation or you end up losing your sight, right? And equally, even if you do have diagnostics, the issue is also lack of timely access to healthcare professionals, right? You may not have the right specialist near you, right? You may not have the right advice at the right time, or quite often hear it too late. So we thought solving these two key issues, so access to diagnostics and access to healthcare professionals, we set that as our fundamental goals in this catalyst. Right. So our focus initially, we said, where are we going to run this? And our proving ground is going to be India. But there's a few reasons for it, right? I think India has got a combination of rural healthcare needs and urban healthcare needs that mirrors pretty much every geography in the world. So if it works in India, the same solution can be rolled out in developing countries, in places like Africa and many other parts of Asia. And the same solutions would also be equally applicable in the West. And if we can make it work in India for 1 billion people, then I think we've done something right. It'll definitely prove the test of time and work for the rest of the world. Right? So looking at Indian healthcare at a glance, we went into some of the numbers in India and found out that 61% of annual deaths is due to lifestyle diseases. So this is interesting. So this is showing us that twin epidemic that's very well alive there. 61% of people are dying because of lifestyle-based diseases. That means there's 39% of people dying due to other reasons. So it's pretty much almost a half-half split, right? And the reasons for that, lack of access to healthcare professionals. The WHO norm for healthcare professionals is 1 doctor for every 1,000 people. In India, it's one doctor for every 1,674 people, so that's not great. And on top of that, these doctors tend to be in the major cities. So which means if you weren't living in a city, your access to healthcare professionals is even worse, right? I think one of my colleagues, Drew, from iClinic was mentioning that there's only like 4,000 dermatologists in the whole country for 1.3 billion people. So that's not a great ratio at all, right? If you look at the disease burden, there's a lot of diabetics, 63 million. That's actually the number that is diagnosed. And the undiagnosed number, people put it at well over 100 million. Again, we need access to diagnostics. There is a rural market where a lot of people are day wage laborers, and they actually need to take a day off work in order to go and visit a healthcare professional. They may not have a healthcare professional in their town, they may not have a lab in their town in order to get tests done. On the urban side, situation's not much better. There's a lot of traffic. I know that if I want to visit a doctor, I still have to take a day off work, pretty much. By the time you go there, you queue, you get your turn, then you go and get some tests done. So a better solution is needed. So that was our health catalyst, where we're trying to bring a digital answer to a real world problem, using connectivity to give access to healthcare services. And a lot of people have access to connectivity in India. So let's use that to actually drive access to healthcare services, right? So the key features of our platform, our 4 key features are: 1, a platform that someone can use in their hand to access all these services. And it has to be mobile phone based. That's what's really predominant. That's what's really common among all users in India. Through this mobile phone, let them discover and have access to healthcare services, including diagnostics. The reports have got to come onto the phone easily for them to be able to see it. Not many people actually want to go to a lab to pick up a result. The ability to share this with a healthcare professional. And one of the things really important to us is secure sharing, because we believe a healthcare data belongs to each and every one of us. It does not belong to the lab that generated it or to the hospital that I went to. It's mine. So I should be able to own it. If I share it with a doctor for a consultation, then I should be able to unshare it once that consultation is done, because it's my healthcare data. And at the same time, through the same platform, you need easy and quick access to doctors. So that's what we've designed in this catalyst. And we have 4 different companies coming together to make this catalyst a reality. Reliance Geo, that's the company that I work for. We are India's largest 4G operator. And we also believe in digital services on top of connectivity, on top of voice and data. So we look to work with partners to bring about this kind of digital services. Axiata, many of you may have heard of. They're actually a Malaysian telecoms conglomerate that has a presence throughout Asia. And they are looking at rolling out similar service in different countries in the region. So in Sri Lanka, in Nepal, in Bangladesh, in Malaysia, and wherever else they have a presence. The 2 champions that we're working with at this point in time is HealthCubed and iClinic. So HealthCubed do a mobile, almost like a lab-in-a-box kind of a service, where you can avail 32 different tests with instantaneous results within minutes. And iClinic have a team of healthcare professionals that can provide you a consultation, either as a chat through a phone, as an audio call, or as a video call. And we all came together and integrated with each other using a TM Forum Open API framework to enable this catalyst. Right? So this is the user journey. Everything starts with a platform that people access through the phone. In our case, it's a platform called Geo Health Hub. It's an app that people can download. Equally, it could be a listing on a phone. It could be as simple as a web page. It's quite flexible as to how you actually want to run it. Now, from there, people discover a service. And as you can see, my colleague Puneet is taking out some of the things that they can do from here. I'll let Puneet actually describe what he's got with him and how the whole workflow works.
Thank you. I think user journey, probably as Ganesh was saying, the few things when we started actually is that one base is connectivity. I think that's what we already talked about. The other thing is, where do people access this service? Where do they find this actually? The access to device. So 103% have connectivity, and most of us have phone, at least one. And most of the people in India have different kind of phones. It can be an Android, iOS, or a small feature phone, which is about $10, so maybe less than that actually. And we have this platform available in all of them. so have access to everybody in each one of them. So it starts from there. The user have access to connectivity in this platform. He goes and actually have access to all these different services where he can go and consult. I can show you it's on here, and you can come to the booth and we can show you in detail everything which is there. And from here, you can just access one click and you can identify the doctor which is there. And we partner with iClinic on this. They have about 2,500 doctors who are there across specialties, and they are providing the online medical opinion service across 50 countries, more than that actually. So we have various doctors where you can select and actually have the service availed from them. And then either you can do a chat. So a lot of the times you're sitting in the office in the meeting and we are using WhatsApp and we are using Facebook, then why not we can't chat with the doctor? I am feeling sad. I am having, a fatigue today, or I am having something else. I can just chat and write a few sentences and doctor can respond to it. And I'm okay if I have to pay whatever little amount for that, it's still okay. So we have a chat, we can do audio, we can do video from here. And for example, I'll give you, as a user at times, I would ignore diabetes if there's somebody has, then you probably can say, hey, listen, I'm feeling fatigued today and also have, kind of a frequent urination. What is it actually? What should I do? And doctor suggests, why don't you go and get a couple of tests done? You should get your glucose tested, that's one. You can go and get your vital tested as well. So your heart rate, maybe, pulse oximetry, which is oxygen in your blood, and blood pressure actually. And as soon as he suggests, I can go and find where the nearest, either the lab provider is, or a portable device, or somebody can come home and actually provide that convenience. The food gets delivered on the phone, via phone, the taxi comes via phone, why not the health can come via phone, right? So the intent is that you discover all of these things and then it comes to you, or you can go to them wherever the nearest is. So you go to a device, a small device. So this is what we have as an Health Cube device. It's a very, a portable device which is charged by a power bank. So a lot of the part which does not have electricity, they do have connectivity, but not electricity. They can still work on a power bank. You can measure the vitals. It has, some slots here through which you can actually measure some of the tests. So it provides rapid diagnostic tests which are based on blood. So you can sense glucose, hemoglobin, that senses anemia, which is a very big problem. It can do chikungunya, it can do dengue, it can do malaria, so a lot of the tests. And it's in near real-time basis. It can take a couple of minutes to a max about 20-30 minutes to get all of these kinds of tests done. And you get the instant reports done and delivered on the phone itself to the user. So just imagine, I don't have to go anywhere actually. It's getting back to me, where I get my food, where I get my transportation, I'm getting my health reports back. And I send that report back to the doctor again, as you recommended. I've got the test done, sitting where I was at home, either rural or urban, no waiting time, not taking off, not losing that salary for a day actually, right? So I can just send it to the doctor, hey, listen here. And he could just suggest, it seems like it's slightly on the higher side, but no need to worry, just maintain lifestyle. Do a walk 30 minutes every day, which we don't do actually, apart from the conferences.
For these 3 days, yeah, we walk a lot.
So he can recommend that and say, just have salad and a few other healthy food, and that's okay. Now, the reason how is all important, it's not only affordable, it's quality healthcare access as well. So people talk when they have heart attack, it's a golden hour. We say when you have any problem related to health, it's a golden minute, right? At that particular moment, if you made a decision that I can get a consultation now, then it's okay. Otherwise, you procrastinate. Not you, we procrastinate actually, right? I have another meeting to go, I'll just forget about it, right? And then it becomes worse actually. So I can make a decision just do at that right moment actually. So that's the whole journey. I'll take you to the next one. So yeah, two things. TM Forum APIs can save lives.
That's a fact, right? That's a fact. TM Forum APIs can save lives.
So two parts here. How TM Forum helped us actually. So one is collaboration, which is the one intrinsic part of having TM Forum. And it's not only open APIs. I'll tell you one thing very differently we did actually. It was not that we're going to roll out OSS. It's not we're going to roll out BSS or we provide connectivity. That was part of it actually. For us, for all the team members, one thing which was common is that what you're going to deliver at the end of is save lives. And we reiterated every time. So it was like impact-driven development. Keep everybody motivated. That's another major problem. We're not motivated enough to work towards certain. So that was the impact we had. Like, we are driven by saving the lives. Even if you save one, your karma is done, right? That's where we started. And we used open APIs to actually do that. Now, some of the reasons I think for the TM Forum is we started with India, but I think the intent was to scale it beyond and to have more healthcare service providers. It's not only going to be two who will solve problem for 1 billion. We want every healthcare service provider to come on board and plug and play here and provide services to these people, have access and quality healthcare delivered right on the phone. So we had that delivered all right on the top in the system itself and the framework. It's easily scalable. As I said, the other service providers can come. We can also go to any other developing country. That's what Axiata is looking at, is how can they replicate this to other developing countries and provide these services and this platform to their people actually. Right? We just go to the next one. This is a communication flow between participants. I think we can go into detail. We looked at quite a few, the APIs which already exist. Some of them we have used for now. That's phase one. Unfortunately, we started working on saving lives only end of the January. If we would have started earlier, we could have saved much more lives. I think we're going to do that. So we have integrated quite a few in there, including some of the customer management APIs, service ordering, document management APIs. So all of those are integrated. This is just showing how the workflow and call flow diagram between the various systems work, which we got frozen very initially so that people can go and start working on these, so then they can communicate, which is there. If any one of you are interested or part of this field, we are happy to help. It could be fitness, wellness, health, anything, or any of you want to work with any of our participants who are there, the Champions, Health Cube, or iClinic, we'll be happy to answer. We go to the next one. This is the other one, which is for online consultation. That was for diagnostics. And then here also, we have, as I said, you can do either a chat, audio, video. We, transfer and call them using our consultation service, and then get the information back and have it, and the reports are shared. The other thing which I think Ganesh said was that you can share the report and then you can unshare it as well. So once my consultation is done with the doctor, I do not want him to access. I can just go and one click, I can just unshare it. And he would not have access to it actually. Now, that's already baked in the system, which is there. We'll just go next. So key learnings actually, I think I'll quickly just say, need for right time identification. The thing is, what we had inbuilt right into the system right from the beginning was that the manual entry of, when you go to a healthcare provider, you have to do a manual entry of data. That's a patient ID, that's the system which is going to be there. So, but what we had is right away integrated the scanning aspect of it so that it's, no manual effort is needed to do that.
Like what happens most often today, when I go to a lab, I need to register myself. So the doctors prescribe me some tests, but I need to give my name, I need to give my mobile number, my date of birth, etc., and register myself. Now, my name is Ganesh Kathirasan. How many of you can spell it? Arms up, anybody? No? Not even fellow people from India. Dhruv, we've worked together for how long now, and you can't spell my name, right? So, okay, but the point is, every time I go to a healthcare center, it's written ever so slightly differently, all right? One time with an E, one time with an I, one time with two A's, right? And that means I'm a different patient quite often, each and every time. So if I want to track how my results have been doing over a period of time, it's not that easy. Now, even if you use my mobile phone number as an identifier, all it needs is one typo in the phone number, and I become him, right? So what we wanted to do was completely eliminate that manual process. So that barcode that he showed, when you turn up at a healthcare center, you present that barcode, they scan it, and we use TM Forum's customer management API that the healthcare center queries us and picks up just the relevant details that they need to register the patient in their system. So the name, the gender, the date of birth. And that's right every time, patient identification. That's a huge thing in healthcare. If you've actually had the misfortune, I say, to have an operation or something, before the operation, you notice a doctor actually comes to you every time and confirms what's your name, right? What are you here for? Because they want to make sure you are the right patient. And this enables right every time patient identification, right? So do you want to
Yeah, I think then we had the need for unshare capability, as I described. You can share and unshare, so the user is in control of. One of the other things we realized very early on is that you need to have support for varied data formats. I don't know how many people here would have gone to parties or family get together and they have doctors in their family, right? And they go and consult them. My shoulder was paining, my knee was paining. What do you suggest? What do you recommend? In India, it's very often. Like in every function, in every party, we go to the doctor, the family doctor, and we queue there. Even he's attending the function, a marriage function, and we sit with him and say, can you tell me? But I don't have reports to show. So we start looking at us to support every kind of data format. That's as is what you see as a user. That report is available. You can see your trends using your charts. So you can see how your hemoglobin, your glucose have done over the span of time. But also the imaging data. That means your MRI and CT scans. That should be available as well to show to your family doctors, obviously. But you can go to the hospital and have access to them anytime. Plus, these are very heavy files, so you can still share them with one click. So we did that as a part of the overall catalyst as well, that we involved and started supporting all of these data formats in the system.
Yeah. So if we look at the impact that we're hoping to bring about with this, it's a better doctor-patient ratio, better healthcare for all of us, right? We want to get more diagnostic devices out there so that people know what's wrong with them sooner, right? People have to be in complete control of his or her own health. That's our ultimate goal, right? Not Big Brother looking after you, not the insurance company looking after you, the government looking after you, but you looking after you, right? And we think all this should be done through a mobile phone, and the ultimate goal is saving lives, right? So if you want to find out more, please do visit us. We're in booth B6 in the Catalyst Zone in level 2, the Digital Ecosystem Catalyst Zone. You can have a chance to try everything out firsthand. So you can actually have a go on the devices. You can see what a doctor's consult is like. Then you can go and have a coffee, then come back and take your readings again, right? And see how it is. Anyway, thank you for listening. And if you have any questions, please ask us.
Thank you.
Right.
Do we have any questions from the audience? We've got time for one. Go ahead.
This one? All right. At this point in time, it's in certain healthcare centers. So they're rolling it out at like pharmacists, at chemist shops where you can put one of these and a paramedic can run it. And they also can take it to the houses near their area. I think a slimmed down version of that is what we would envisage to be in everybody's home. I don't think everybody needs the ability to measure your cholesterol every day. So some slimmed down version could be a home product. Mm-hmm. Yes, absolutely. Yeah.
I actually have a question.
Sure.
India is a very, very diverse country, and you were mentioning bringing quality healthcare also to rural areas. What about language support? Is this only
of the 2,500 doctors, they actually speak all the regional languages in India. So English and the regional languages.
And so this would support all of the languages?
Yes.
Brilliant.
Yes. Yeah.
Thank you. Thank you very
Cool.
much.
Thank you.
Thank you.
Thank you.